Hi everyone, my name is Stefania. I'm a specialist personal trainer with over 9 years experience in the industry. Today I'd like to talk to you about a condition that affects many women worldwide, and that's diabetes. There are two types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disease. What that means is that your immune system attacks a part of your body. In the case of diabetes, attacks the cells in the pancreas that are responsible for making insulin, and as a result your body can't produce insulin, and without insulin you die. Type 2 diabetes is what is known now as the lifestyle diabetes, whereby your pancreas is not producing enough insulin, or your body has become resistant. Your cells have become resistant to insulin, don't recognize insulin produced anymore, so you're classed as insulin resistant. Type 2 diabetes, it's different in type 1 respect that it's not down to an autoimmune disease, it's actually down to lifestyle, and that includes diet, poor diet I should say, lack of activity or very little activity, stressful lifestyle, and environmental factors, so pollution and everything like that. Although there is a small genetic factor in type 2 diabetes as well, whereby certain ethnic groups are more predisposed to developing type 2 diabetes when put in a situation where the genes get activated, and it's normally when you got the poor lifestyle factors coming into play. In the UK, at the moment, we got little like an epidemic when it comes to diabetes, but we're not the only one, unfortunately. The whole world is suffering from an epidemic of diabetes. According to recent figures, we have about 24,000 deaths a year from diabetes. Yes, diabetes kills. It's not just a question about taking a pill and you're fixed. And 7,000 amputations. I mean, this is big, yeah? An amputation is a life-changing event. You might not die, but an amputation is a big life-changing event. It will affect everything. It will affect your ability to work, your ability to enjoy life, so big difference. And all of this could be avoided with a right diet and exercise. Because the reality is, while type 1 diabetes can only be controlled with insulin, because as I say, the body just doesn't have the capability of producing insulin in the first place, type 2 diabetes can actually be controlled with the healthy lifestyle and healthy diet, and obviously exercise to go with that. Although doctors tend to give metformin, typically in the UK, so insulin tablets, the reality is as you go over time, the body then adjusts to the insulin tablets, and because diabetes type 2 is caused by insulin resistance, your cells are basically resistant to insulin. So what happens when you give more insulin? Eventually it gets worse and worse. You have to up your amount of insulin until eventually you end up on injections, just like a type 1 diabetic will end up, and you're going to be totally reliant on that. You can't fix anymore. So the chance for you to fix it for type 2 diabetes is the moment you've been diagnosed, ideally. But even if you've been diagnosed for a few years, start taking steps now, and you can decrease your medication through healthy diet, healthy activity, and lifestyle changes to help you in the process as well. And I've had cases where people have actually come off insulin completely. So it can be reversed. Insulin resistance can be reversed with food and correct food and exercise. Now, the problem we got in the UK is that while in the past there used to be lots of funding for schemes for diabetics, whereby the NHS will put groups together, will contact a personal trainer like myself, and normally a psychologist, the GP of the patient will be the main person in there, and then you will have a dietitian as well, and then people qualified for these schemes will be looked after by all these professionals, and for a period of 6 months, 12 months, however long the scheme was running for the particular council. Council was slightly different on how they were running, and then the person was looked after properly. We would teach them how to eat, how to make the lifestyle changes needed, and how to exercise, and get them back on the health path, if you like. Unfortunately, these schemes are expensive and the funding is gone. And I haven't been part of one of these schemes for a couple of years now. They're not around. And if there's some, definitely nowhere around where I live, unfortunately, because I think it's one of the best schemes, best things government could have done for it. So what happens now to diabetics is that if you're diagnosed as diabetic or even pre-diabetic, the doctor will give you a leaflet. And the leaflet tells you what diabetes is, and it tells you these are the foods you can have, these are what you should avoid. The problem with that is that the dietary guidelines on these flyers are old. They're based on many years ago, and they're totally unsuitable for the level of inactivity that we have these days, where most jobs are sitting down on the desk, actually not doing anything. Those guidelines are based on people moving and not sitting down all the time, and eating the right food, not eating all those processed foods full of salt, full of sugar. They are not having the effect that they're supposed to have. And if somebody's diabetic goes online and checks what is available, the information out there is at best confusing, at worst completely wrong. So what's the solution? Well, you need, as if you're diabetic or if you are pre-diabetic, so you could have gone to the doctor and they done a blood test and they tell you, okay, you're not diabetic yet, but you're based on the upper range of the glucose test. And they tell you, okay, you got a chance to fix it now, or we're going to put you on medication. So if you're pre-diabetic, or if you're already diabetic and taking medication, or if you're concerned because you got people in the family, they got diabetes, and there is genetic factor in type 2 diabetes as well, your chances of having diabetes, somebody close to you, like immediate family, got diabetes, is increased. If you're any of these people and you want to fix yourself before going on higher medication, if you're already medication, or being put on medication, which then will have side effects and all the type of stuff, then the solution for you is to have a personalized program. Why am I saying that? Because there's a lot of programs out there. You can check online. There's applications. There's blogs. There's all sort of stuff out there for weight loss. For fitness, for diet. All of these programs are designed for the average person. So with no medical condition specifically, and assuming that you are not on specific medication. If you're diabetic 1 or diabetic 2, diabetic 1 even more so, because you have to be extra careful with the diabetic 1, those programs are null and void for you. They are pointless, completely pointless. Not only that, they can actually be dangerous, because the advice they give in some of those programs, if you're type 1 diabetic, can actually get you into the diabetic coma. If you're type 2 diabetic, you probably will find you get no results and suffer in the process. So what you need is a truly specialized program which takes into account, first of all, what type of diabetes you have, because that is a big thing, makes a difference. And then also takes into account your specific lifestyle. So are you able to cook? Can you cook? How many hours you work, because as I mentioned to you, diabetes, especially type 2 diabetes, is brought on by lifestyle, by a bad lifestyle, which includes stress level, which includes possibly poor sleep, which includes a bad diet, which includes lack of activity. So you need a program that takes into account the fact that you're diabetic, so whether or not you're on medication, what type of diabetes you have. It takes into account your specific circumstances, lifestyle circumstances, your specific dietary requirements, because you might be allergic to certain food, lactose allergic, or you could be gluten allergic, like myself, I'm celiac, so you could be allergic to gluten. Or you may have special dietary choices, like beliefs, like you could be vegan or vegetarian, it could be halal, it could be anything, So the programs you find, off the shelf, as I call them, program online, they don't do any of that, because they're designed just to do a standard program that works for weight loss, or works for this or for that, and therefore are totally unsuitable for diabetics. In addition to that, as well as taking in account all of these things, we also need to take in account what you want to achieve. because is, the assumption is that diabetics want to lose weight, but actually most type 1 diabetics are thin, they're not overweight. So they don't give a damn about losing weight. They got totally different goals. So a program has to be specific to diabetes, specific to your circumstances, your dietary requirements, as well as your lifestyle, to remain sustainable, and of course in line with what you want to achieve from a program. So the solution is this. I've created a program, a 6 weeks diabetes control program. As part of the program, you get an initial consultation where we go through, can be done on Skype or on the phone, is your choice entirely, where we're going to go through everything from how diabetes is affecting you. First of all, what type of diabetes you got, or have you got diabetes? You might have just been told you're borderline, so you haven't quite developed it, but you got one foot through the door, if you like. And how it's affecting you on a daily basis, or what symptoms are you getting. We're going to talk about your lifestyle, so get an idea of what are possible triggers you have within your lifestyle that is making the condition worse. We're going to look at, discuss your dietary requirements or allergies, preferences, choices, whatever might be the case. And ability in respect of exercise. Have you exercised in the past? You're a total novice, or you're intermediate, or even advanced, because diabetic can be advanced as well. It doesn't mean anything that because you're diabetic you can't exercise, that is rubbish. So after this consultation, I will prepare a personalized program just for you. So that includes a nutrition program and an exercise program. And I will give you access to an online application which is free, and you get access via your own specific logins, so nobody else gets access. That is your program, done just for you, with your requirements, with your situation, with your type of diabetes and everything. And then this is a 6 weeks program. So week 3, we're going to do a review, and we're going to do another review at week 6. So when we do these reviews, it can be phone, can be Skype, whatever you're happy with. You want to see my face, bless you. You can do that on Skype, otherwise you do it over the phone. It's your choice, as I said. And during this consultation, I'm gonna be asking you to complete a form where you record your measurements, which you would have done at the beginning of the program as well. So we got starting point, middle point, and end point for your measurements, if weight loss is one thing that you want to achieve, obviously. And then week 3, halfway through the program, we have a discussion. We're going to see how you progressed so far in the first 3 weeks. I answer any questions you have, any concerns you might have, what worked well for you, what didn't work quite so well, what we need to change, to get you to progress more. And then week 6, we do exactly the same. So we see the end result, what you achieve so far in 6 weeks. And again, I give you advice on what you need to do for the next few weeks or months or whatever you want to do. And then at that point is entirely your choice what you want to do. I do offer a monthly membership program whereby people can get access to me, for the consultation once a month, and we go through review again every time, once a month. So same thing, finding out what's working, what you got problem with, what you like, what you don't like, give you more advice to keep you going to the following month. Or you can decide to come on another 6 weeks program. Of course, we will change all your exercise plan, because by then your body's adapted. So we'll jiggle things around to make sure you still get progress from that. Or you might decide, listen, I am 100% now. I understand how it all works. Happy to go it alone. Thank you very much. Perfect. No problem at all. So if you're tired of feeling tired, because diabetes is one of the signs, symptoms of both this tiredness, extreme thirst, and if you're tired of worrying about whether you're going to have to go on medication if you're not diabetic yet, or worry about whether they're going to move you from tablets onto to injections. Not many people like to be injected, so we have to inject themselves, actually I should say, every day. Or if you're already on injection because you're type 1 diabetic, you want to try to maximize your get your body working optimally, so get your energies up and everything. And with actually the possibility you might be able to reduce some of the insulin as well if you're type 1 diabetic. Then all you gotta do is join my 6 weeks program. Click on the button, join the program. You'll be able to book a consultation, to get you started straight away, and we'll take it from there. We'll help you regain your health. And by the way, I did not mention this, but if you are diabetic, that's another statistic, your lifespan has been shortened by 25%. So you have, if everything I've mentioned is not motivation enough to get you changing things, especially if you can change them with type 2 diabetes, then just remember that by not doing anything, you're going to shorten your lifespan. Not to mention, you're going to be open to all sorts of other autoimmune diseases and problems like high cholesterol, high blood pressure, and possibly heart conditions that, are very serious. So I hope you're going to come and joining us. I would love to help you and get you back to health and reduce medication. You come off medication if you're type 2 diabetic, or help you to improve your life and enjoy life, better quality of life if you're type 1 diabetic. And hopefully I'll speak to you soon. Bye.